There we are. It's being live streamed. So now Kitty will open the virtual doors, Robyn. All the very best to you. Have a lovely session. We're here in the background to support you.
Thank you. Hi, everybody. My name is Robyn Stern. I'm a licensed clinical social worker. I specialize in the treatment of body dysmorphic disorder, and I do the treatment in the United States. I myself also have body dysmorphic disorder. So I speak not only from a clinical lens, but also from a lived experience. And advocacy work for body dysmorphic disorder is something I'm super passionate about, and something that I continue to want to be a part of, and to get the message out there on the right treatment and support for people that struggle and suffer with this distressing disorder. So we'll go to our next slide. And also, oh, hang on one second, because I'm not, Kitty, can you just move the slide to the right?
So I'm having difficulty on my side. Give me one moment.
And also, what I wanted to share with everybody is that you are more than welcome to put questions in the question box, and I will be taking questions and have a question and answer after the presentation. So I put together a PowerPoint presentation just to highlight some important facts and information. So what I wanted to just talk initially about is the research on social media. And in general, this is more related just to mental health issues. So, you know, in the UK, there's just so much research right now with BDD, and there's so much being done, and the movement is going in an amazing direction. You know, being in the US, I would like to see a little bit more go on, but right now there is no exact research on social media and the correlation with BDD. But what the research does show is that there exists for people with depression and loneliness and anxiety. And so we see that there is an increase in depression with people that use Facebook, and that within the first year of college, there is an increased incidence of loneliness. And obviously we know that those are two things that are very common with people that have body dysmorphic disorder. There is a component of depressive symptoms. There is a component of isolation, and loneliness. And so, especially when you're in an acute situation where you're struggling with BDD. So again, while there is no direct research currently, at least from the United States perspective, on social media and BDD, we do see that there is research on social media and depression and loneliness. And we take that information and we then, you know, project that onto how somebody with BDD may be affected by it. And so we'll go on to the next screen, which is going to talk a little bit about body dysmorphic disorder. So again, this is more related to body image. What we do know is that an increased Facebook use may lead to body image insecurity, bullying, and body shaming. People with BDD are much more susceptible. I want to start off the conversation by saying this. In an ideal world, I would say that social media is not that healthy for somebody that has BDD. But on the flip side of that, it is not probably realistic for people with BDD to be completely off social media. I know myself, when I was in treatment at various points, that when I was more in an acute stage where I was really struggling, the recommendation from my own therapist was that I take a social media vacation. And so even now in recovery, I do take time off from social media because I don't find it extremely healthy, and at times I find it toxic. So again, I want to talk about how we really can navigate using social media with BDD, but understanding, let's say, pitfalls and things to be aware of. So again, in general, if we're looking at Facebook can lead people to having body image insecurity, bullying, and body shaming, we know that that stuff exists for a person who has the diagnosis of BDD. And so we need to be aware of that. And studies have shown that 94% have experienced social difficulties from embarrassment related to appearance. And this is for people also not having BDD. So if you think about a person with BDD who feels there is also, a lot of times people with body dysmorphic disorder have kind of secondary social anxiety because they feel that other people are seeing their perceived defect. Then we can understand how this can even be more detrimental to a person who has BDD. While the research on appearance comparison is limited, we do know that people with BDD always compare. It is a compulsion that we see all the time, and having social media images make it more, it's easier and accessible for people to do that. So one thing to help people is having an awareness when you're going on social media and knowing that things are going to pop up and come to your attention, and to try to kind of go on with this notion, I am not going to compare myself to other people. I'm not going to use social media to kind of ascertain how I look in comparison to another individual, because that is going to be very distressing to you. We know that right now there's little attention paid to social phobia and BDD, in spite that there is the comorbidity. Again, if we think about what social media is and we think about being on screen time doesn't allow us to be in the present moment. It doesn't allow us to live in the here and now. And when we're doing BDD treatment, part of the exposure is living. It's going out into the world. And so if you think about being behind a screen, it kind of goes against what we're trying to do in treatment. So remember that it gives someone a sense like they're interacting because they're interacting with people beyond in a social media platform, but in the same respect, they're not in the real world interacting. So it's not the best thing for someone with BDD in terms of exposure and getting out into the world and being social. Again, I would always say that I think social media has some benefits. I think that, it connects you to friends and family, but I also think from an appearance related standpoint, it can be very tricky. And so it's about really having the tools and strategies to navigate it in a way where you can use it in the most healthy way possible. And knowing when you're feeling triggered, like maybe you should step back, right? So let's take a look at the next slide and we'll go from there. And remember, please ask any questions and I'll be open to answering things. So what we know, again, I talked a little bit about what is the negative impact of social media. So it promotes isolation, which is a direct correlation of what we see with people with BDD. So in the thick of our disorder, the thick of the pain of body dysmorphic disorder, we isolate and we stay inside and we don't want to be around people for fear that others are going to notice the imperfections we see in ourselves. And so being behind a screen promotes this isolation. And when we're doing treatment, we want to do the opposite of that. We don't want to isolate. So it's really finding the balance, being out in the world, also being able to use social media and its platforms, but not relying solely on it as a way to interact in the world. It can feed compulsions because if you're comparing, let's say, your skin to somebody else's skin, you're doing comparing. There can be a ton of compulsions to it. You can be looking up procedures. Pop-up ads can be geared towards you. So it can really feed compulsions in a negative way. It can impact self-esteem because you could perceive other people to be having things that you don't have, whether it's related to physical appearance or just living life. I always tell people, most people are not sharing their pains and difficulties online. They're posting snapshot moments of great experiences and oftentimes elaborating them. So remember kind of what you're comparing to. The next two things are important because it can expose sufferers to false information about BDD. While I think it's great for people to have a face to it, what I love about the BDD Foundation and what I love about like the International OCD Foundation in the United States is that it's all with research evidence-based practitioners. And so when we're providing webinars and conferences, it's all about the information we're giving you, which is evidence-based and factual. Now, when you're going online, you have people that want, and it's nice that you want to help people, but what I call is it's unvetted. We don't know who's talking and speaking, and we don't know the platform. And people with BDD are very vulnerable and they're very alone. And so you have to be careful that the information that you're receiving is accurate and helpful and not damaging. It also allows advertisers to target those with BDD. So again, I don't know exactly what kind of breaks it down for like the pop-up ads to come up. But maybe if the person was doing compulsions, let's say, and Googling, procedures or cosmetics and stuff like that, then pop-up ads can start to come up to show you, okay, here are procedures, here are ads. And that's also very detrimental to a person who is struggling with BDD. We'll go to the next slide. So very important that the idea of promoting isolation. So myself included, when I was really struggling with BDD, I was housebound. I was housebound for the first time before I got diagnosed for at least 30 days. It didn't leave my home. And this was, I'm dating myself because I'm 42 years old, but this is before the age of social media, before the age really of the internet per se. But we do know that with people with BDD, a large portion of people who are really struggling are housebound or have a hard time leaving their home. And so the notion of having the ability to somehow feel part of the world, while yes, that is a good thing to feel part of things, we also want to remind you that it's more important for you to be in this world. I would sooner rather have somebody go out to the store and get a coffee or go get a pack of gum than to just go on social media for an hour and to be interacting with profiles. To me, it develops a false sense of comfort, and it's not really putting somebody with BDD in the exposure situation, which is going to give them more opportunity to engage in life and to really kind of like question and dispute those false narratives in their brain that they look defective, so people will perceive them to be defective. Again, it reinforces the notion of faulty perception about appearance, because you're comparing yourself, I always say this, and they'll be on the later screens, to filtered images, to glammed images. I am so vigilant of this, probably because I have BDD, and the notion has always been, I don't want someone to think that I am not who my picture is. So I think that's probably because I have BDD that I'm very aware of it. But I am extremely vigilant of not filtering my photos, because I feel, one, it promotes dishonesty, and two, people that have BDD are very vulnerable to that. And when they start comparing, they think that the level of attractiveness is a level that is almost unachievable, because it's actually not existing. So when you're comparing yourself on a social media platform, you have no way to challenge that, because you're looking just at an image and you're just assuming that image to be factual, and you have nothing competing back. Again, especially if you're struggling, you can experience poor quality of life because you have difficulty transitioning to the outside world. Because if you're just staying behind a screen, it's going to be really hard for you to challenge that and go out. And especially if your barometer of what you think people look like is this like perfect image, filtered, no pores, nothing wrong with no one's perfect. And if you think that that's what exists, then it might be harder for you to challenge yourself to go out into the world and feel like you can be a part of society. And it will definitely contribute to avoidance behaviors. So again, I mean, these are some of the negative things. And I do know that for some people, I would say this rule of thumb, less is more. I think in general, people with BDD should limit themselves to social media. Even myself in recovery, it's just something that I don't feel is an adequate use of my time. I feel like living in the world in the here and now, in the present moment, as someone who's really struggled with BDD, feels much more fulfilling than sitting behind a screen. I also know that I am vulnerable, as if anybody with BDD is vulnerable, to these ads and to photos. And I am always vulnerable, if not using my strategies, to start to compare myself and to feel less than. And again, I think that, as a therapist and as someone who does advocacy work, on some level, I need to have a social media presence, but I am very cognizant of what that looks like, and I do take vacations and space from it. So I think a good kind of rule of thumb would be to either set a certain amount of time depending upon really knowing what your BDD issues are, you should really limit things that really cause it to spike. So limit kind of looking at profiles and comparing. If you're going on it because you want to look for a great restaurant or a great place to travel, awesome. If you're going on it to look to connect with friends or family. But if you notice that the drive to go on it is because you want to look at other photos, compare yourself, or looking for procedures, or looking at cosmetics and things like that, I would really suggest that you don't do it. And then when you start to ascertain like where you're at and the stress level is increasing, you need to step back. I can't stress that enough. I do work with clients, and my recommendation really at the beginning when there are in an acute level of distress is to delete social media and be able to learn how to acclimate up to a healthier way when you're feeling better. So we'll go to the next slide. So again, I mean, it feeds compulsions. And when we look at BDD, we look at intrusive thoughts, we look at compulsive behaviors, and we all know the issue isn't just the intrusive thoughts to the person with BDD. It is. It's the intrusive thoughts of feeling, and again, I'll use the word that I used to describe myself: disgusting, gross, repulsive, unlovable, unworthy. And those were thoughts, but the compulsive behaviors coupled with it were making the thoughts that much stronger, and which makes it harder. So you can be doing compulsive things like logging on to social media multiple times a day. You're comparing yourself to photoshopped images and your perceived flaws to these images. And it can exacerbate the obsessions and compulsions. It can make you feel the urge to take abundance of selfies, and then you start to filter and Photoshop and Facetune yourself. And so this isn't great, because in the work we do with BDD, we're trying to have you realize that this is a disorder about a perceptual distortion in how you see yourself. This is not a disorder in appearance. This is a disorder in that you don't see yourself. It may be a smaller, non-existent defect in appearance. And I don't like that word defect, but it's in the DSM-5. And the person with BDD sees it on a more elaborate scale. And so the notion that they begin to filter, Photoshop, and compare is very detrimental to a person. So always goal when we're doing BDD work is to ensure that you become more than your physical appearance, that your physical appearance is an attribute to who you are, but it does not define you, and that you don't navigate the world based upon how you perceive yourself to look. I always say perceive because, again, this disorder is about distortion of perception. So we'll go to the next slide. So we know that it impacts self-esteem, that, social media just in and of itself, especially things like Instagram, where it's just really photos, we're really emphasizing that appearance is your worth and value. And for BDD, that's essentially what somebody feels like, right? So when we're really in the pain and the thick of this disorder, we essentially feel like if we change the physical attributes, so if we change our skin, if we change our nose, if we change aspects of our body, then our life is all of a sudden going to be great. And we know that that is not the answer, which is why there's evidence-based work in how to treat BDD with CBT ERP. And we know that that's not the answer to giving yourself a full life. It also distorts what you see, because you're really comparing yourself to non-existent people because it's photoshopped and it's filtering. And it's really giving you this notion that people are physically perfect when they're not. And it's interesting because I do find something, and again, this is not based on research, this is more based upon kind of conversation I've had with clients and just my own kind of observation, is that most people with body dysmorphic disorder are less likely to overly filter their photos. Again, I find it because they're so afraid, and this is more of a newer term, that they're going to be seen as a catfish. They're less likely to do that. But I want to be clear. Most other people who don't have this disorder and most other people on social media are filtering their photos to no avail, to the point where they don't even exist. It doesn't even look like, I don't even know what we're looking at anymore. And so that's a big thing that, like, at least for me, and is a really good strategy here. You need to know when you're going on these platforms that that's what you're going to be seeing. So it's like automatic. I'm going on social media. Whatever photos I see, those are filtered. Whatever photos I see, those are photoshopped. You need to kind of like, every person with BDD has to have that awareness going in. Now, that doesn't mean you're not going to be triggered. Let's be clear. It's like the same thing of like, we know we have BDD, yet we still don't like what we look like, and it still can impact our functioning. But we need to have that little piece of information, because you are literally comparing yourself to a non-existent person. Most people are not showing their selves on social media. There are some platforms that, let's say, are acne positive and stuff like that, but that's not where people with BDD are going, right? They're going to celebrities, and they're going to influencers, and they're going to skincare products and esthetician pages of people with filtered images. Okay. My favorite actually is when somebody says this is not filtered, and then you see on the corner the filter they're using. I'm just like, I don't even know what to say to that, but I'm all about honesty. So I feel like if it's something, I don't want to criticize a person for using filtering, but in the same respect, I think that we should just be honest if we're using it, because it just, obviously I know how vulnerable people with BDD are. So again, I would just say a good strategy would be knowing when you're going on social media platforms, what you're seeing is most likely photoshopped, most likely altered. And so realize that, one, you see yourself distorted, because that's a cornerstone of BDD. Two, what you're comparing yourself to doesn't really exist. And three, you don't know really what you look like. And then four, we need to be more than our appearance, because the answer in getting healthy and living a full life is not going to be in comparing, and not going to be in trying to change your appearance. We wish that was the answer, but it's not. And I know that's hard, and it's a concept that you need to continue to work towards, but that's the reality with people with BDD. Also, it does contribute to self-loathing behavior, and there could be bullying on social media. So it's not the best place to be. I mean, I just posted something that had nothing to do with anything, and somebody's response was just so negative and hateful. Sometimes I wonder, like, what am I using this platform for? Sometimes I feel like the platform is good. Like, we're able to be here today. We're all able to speak. I'm able to connect with the UK. I'm in the United States. But sometimes it's just, there's just the value in it sometimes is if there's so much negative and distress associated with it, sometimes the answer is just a break or reduction in the use of it. So we'll go to the next page. So how do we deal with the impact of social media for those with BDD? So again, it's about awareness. I know, like, me and Kitty, we were talking about like, this is important to know how to navigate using social media with BDD. Like, I don't want this presentation today to be about you can't use it, because that's not a reality. You know, like, again, do I think it's that healthy? No, but I think most people either have to use it professionally, on some level want to use it. And so this isn't about saying like you cannot use it. This is not about saying like to get into recovery, you can't be on these platforms. This is about saying, okay, this could cause certain issues. So you need to be aware of that, and you need to have the tools and strategies so that you can be like vigilant on your care and make sure that you're doing okay. So it is important to see what the impact of social media is. And we do see that it affects your self-esteem. It can affect depression in a negative way. It can increase isolation. You could feel like you look like a catfish. I think people with BDD without social media feel that way. And I'm sure if anybody wants to respond to that in the question section, I would love to hear people's thoughts on that. I don't even think we need social media for people with BDD to think, I don't look how others see me. And sometimes I feel like if somebody saw me now, I'm going to look different 2 hours from now. So I want to be clear. I don't even know if we need social media for that term, but it helps to promote that. And then again, those pop-up ads that are geared towards appearance, that can make you feel like I need to change these attributes of myself. And we know that that is never the answer. So we'll move forward. Again, filters and Photoshop. And I've had a lot of people, most of them not having BDD or any body image issues, say, well, I like to filter. And that's fine. There's no criticism there, but we all know as somebody with BDD, like when we see our areas of concern and we see it like non-existent in another person, could be envy. There could be a sense of, I want to change, but this is the thing, like it doesn't even exist. And I think that that's a very interesting thing. I've had conversations with plastic surgeons and dermatologists, and as a professional, and the conversation is like, people are coming in wanting certain procedures, and like that isn't even achievable results because that doesn't exist. It's a filter, it's a Photoshop. And again, I think there is no criticism on people who use that. I just think people with BDD are more vulnerable when they see it, thinking that they need to look this way. It's a false sense of expectation. And they're very edited, these photos. I mean, what I've noticed a lot of filtering photos, it's like you can't even make out like the physical features because it's just kind of like blurred. And again, to each their own. I'm here today to talk about the negative impact on BDD and how we need to navigate that. So again, I feel like I'm repetitive here, but knowing that that's what you're looking at, knowing you're looking at filtered images, very important from the get-go to know that. Another thing would be, you shouldn't really follow, influencers that are based on beauty. One would say, well, isn't it a good thing to follow somebody acne positive? My response to that with somebody with BDD, you probably just shouldn't be following anybody with regards to appearance. I'm going to be honest. I think when we're doing BDD treatment and when we're living a life in recovery, what we really want to focus on is living life where our appearance doesn't dictate who we are. It is an attribute of ourselves, but in order to really live in recovery with BDD, that can't be our leading attribute. So another suggestion would be, your social media followings shouldn't really be appearance related. It shouldn't be people that are bodybuilders. It shouldn't be people that are celebrities that promote skincare and makeups and cosmetics and procedures. That all will lead you to being more vulnerable and susceptible to feeling more distressed and for BDD symptoms to increase. So we'll go to the next page. So again, this kind of goes back to celebrities adding the pressure to look a certain way. Back in the day, we didn't have access to people the same way. It was mostly through magazines and TV and movies. And now with social media, we have this false sense that we have some connection to these celebrities, and they promote a lot of appearance related content. And, they glamorize procedures, cosmetic skincare treatments and products. And that's obviously dangerous for people with BDD, because people with BDD who are open and possibly get these procedures, most of them are very unhappy with the results and can often feel extremely depressed, and trigger warning, could feel suicidal. So it's very important, like, what you're subjecting yourself to. Like, it's not healthy and it's not going to be helpful in recovery. And so, other people who don't have BDD are probably able to look at procedures online and see celebrities and kind of say, oh, that's their thing. But people with BDD are so vulnerable when they see things that celebrities are glamorizing or people are saying is like life-changing. People with BDD want that to be their answer, because the deeper work that we have to deal with BDD is a lot harder. So again, we just have to be aware of that, knowing also that it sets unrealistic expectations, and there's the use of filtering and photoshopping, which also just means that these photos are just edited and not real. So we'll go to the next. Okay. This is an unfortunate thing, and this is something that I talk about with clients all the time, and this is something people with BDD, I'm sure, feel often. And this is a reality of life in an appearance focused world. There is this like societal pressure to look perfect or filtered. But I'm going to step that back for a second and say, body dysmorphic disorder is not a disorder of ugliness. It's not a disorder of defect. It is a person having processing issues of how they see themselves. We know that the studies have shown that people with BDD, their brains light up in various areas. They're functional MRI studies out of UCLA with Dr. Jamie Fusner. And we see that people with BDD, their brains do not light up in the same places with people who don't. Their spatial processing is different, which means how they see themselves and what they see is different than those who don't have this disorder. So I understand that a person with BDD sees their flaw, but that's not what anybody else sees. And that's because our brains, and I say ours because I have it, don't see ourselves accurately. But we are in a world that pushes appearance. We are in a world that pushes perfection and filters. So how do we navigate that so it doesn't take us out? And it's about, again, really reducing as much as possible. I love just living in the world, getting out into the world. I know it's difficult, but going to a yoga class, going to the park, walking outside, meeting a friend for coffee or tea, or being out in the world is always going to be more fulfilling, especially for somebody with BDD, than sitting behind a screen. Because when you're behind a screen, you're isolating, you're comparing, and you're fueling and feeding this disorder, the beast of BDD. And it may lead you to feel like you want to get cosmetic procedures, you want to buy more skincare, and a lot of comparing. And it just, I feel people in general, whether they have BDD or not, usually don't feel good when they are on social media. Like, forget having a diagnosis of this. What we see is that it just affects relationships. It affects just self-esteem in general. And so now imagine somebody with BDD who all the issues of self-esteem, all the issues of isolation and depression and social anxiety and self-loathing. It again, the benefits, sometimes job related, but knowing, like, let's not follow those influencers. Let's really monitor our time, knowing you're going on and looking at filtered images, knowing, like, okay, you could even tell yourself, like, from a behavioral standpoint, okay, I'm going on now, like, BDD is going to want to go wild here and compare myself. Let's not do that. Let's really realize what it is we're doing here. We're going on because we want to look for a restaurant. We're going on because we want to look for a place to go on vacation. Anything that I see that may trigger my BDD, if I feel triggered, I come off of it for right now. And I sit with that discomfort. I don't go in the mirror. I don't Google, right? So it's all those behavioral strategies that you can do when you're feeling triggered online. So we'll go to the next slide. So why do you need to compare yourself? Stop comparing yourself on social media. We'll go to the next slide. Because this exists. And no criticism here. Again, I'm not criticizing. Please, if you need to filter photos, that is fine. As somebody with BDD and as somebody who treats 70% of my practice as people with BDD, people are devastated by this. When they see the picture to the right, they think that is what they need to look like. What you don't realize is the picture to the left is what they look like. Both are pretty, both are great, but one shows more definition. The one on the left shows reality. Even still glammed, right? So even still made up, makeup and whatever, and hair done. But the one to the right is filtered, it's airbrushed. But guess what? The person with BDD sees the one to the right, does not see the one to the left, and they're devastated. And this is the problem. In something like this, I personally, as someone with BDD, don't understand it, right? I don't understand what the need to filter to non-recognition. I'm not really understanding what that does, but I wish that there was some kind of disclosure, like, this is a filtered image, beware. Because again, somebody with BDD, body image, it could be an eating disorder, are more susceptible to being triggered by this. But this is a perfect example that we're not seeing the left image, we're seeing the right. And the right image is making somebody with BDD feel inadequate, feeling like they need to become this. But guess what? These people are not that. And so that's why comparing yourself to social media on social media is a pitfall, and you're not going to get out of it what you think is going to be. It's going to make you feel less than. So we're going to go to the next slide. So again, advertisers target people with BDD. There's pop-ups for skincare, cosmetic procedures, hair products, supplements, surgical procedures. Not the most ideal environment with someone with BDD, but I'm going to give you a flip side. I'm going to tell you something here. When you're in treatment with BDD, on some level, is it great to minimize this access to it? Absolutely. But in the real world, guess what? We have no control over that. And so the goal is somebody that has BDD, how can you navigate that? I remember one of the worst fears for me was that somebody was going to point out, because my issue was my concern with my skin, someone's going to point out a pimple. And sure enough, when I was in a good stage of recovery, somebody actually did that I worked with. She was like, oh my God, Robyn, what is that pimple on your chin? And that was probably a 10 on my hierarchy, a 10 out of 10. And what I realized after was like, wow, that just sounded silly because she's like an older woman. Why is she making a comment about my skin? And it actually caused less distress than I actually thought. And so while I am sharing this information about like what could potentially be like hazards to someone with BDD, the reality is this: people with BDD are going to have to be in the world, and things like this will always come their way. You're not able to live in a world where appearance won't enter your vision. You're going to be in places where you go to stores and cosmetics will be around you or skincare be around you. You're going to go places where a doctor's office, even a dental office in the United States, offers Botox. So it's going to happen. So but again, it's about awareness. So awareness of these pop-ups, awareness, okay, when you see it, click right off of it, move along. And again, I can't reinforce enough. It may trigger you, sit with that level of discomfort. Don't do any Googling. Don't start to look at it. There's nothing positive with going in the direction. But I do want to say, playing devil's advocate, this is just a microcosm of what's in the real world, right? So in treatment, so I want to be clear, if you're really struggling with BDD, I do suggest that you get it managed while working with a therapist and maybe step back from social media. When you start to reacclimate and start to re-engage with social media, it's about learning how to use it more effectively. And, understanding that things like this are going to come up, and these pop-up ads will come up, but not to click on it. And it's just like the rest of the world. Like, somebody made a comment about my skin. In therapy, when I was like 20 years ago, the recommendation was with my friend and family not to talk about my skin. But in reality, it could happen in the real world, right? And if somebody says something, I have to know how to handle it, because otherwise, if I don't, it's going to destroy me. So in this respect, it's about understanding, okay, it's going to exist. The pop-up ads are going to come out. Let's not click on it. So let's go to the next slide. So again, sometimes we can expose sufferers to false information about BDD. So there's unvetted sites. I remember at one point, about like 6 or 7 years ago, I was doing a BDD support group, and I thought it was a really great thing for me to do. But even as a therapist, I felt that it was a lot for me to do, because I would have people messaging me and say, like, if I don't get back to them, they're going to hurt themselves and all these other things. And it's just, BDD is a very serious diagnosis with a lot of comorbid concerns and a lot of things. And so I really feel strongly that the best place to get the information would be, let's say, like the BDD Foundation in the UK. They promote a lot of like psychoeducation and great information and resources. In the United States, the IOCF provides BDD information, and going to a therapist. But unvetted sites can be dangerous, and you don't know who's running them. What I notice sometimes of clients that have been in like unvetted support groups is that oftentimes people are reassuring each other of their appearance concerns. And we know that that's not really effective and counterproductive to success in treatment. And so that kind of goes to that second one of like these support pages and groups. I love support groups. I was in one myself 17 years ago. Great. It's a great opportunity for people with BDD to connect with one another. But again, really important for them to be facilitated by people that know what they're doing. And it can be a platform for reassurance behaviors. I had clients that would come in and show me like Reddit pages where they would go on and upload a photo and ask them, can you see my defect? Can you see if I'm ugly? And this is just not healthy and helpful. So, stuff like that would be very harmful to somebody with BDD. So we'll go to the next page. So the positive impact. So again, we can stay in contact with people. We can meet people. This is how I got in contact with the BDD Foundation in the UK. We can provide psychoeducation, like we're able to come on today and do this webinar on social media. It's great. Like, this information is invaluable. I wish I had this over 20 years ago. This is what's going to help people with BDD. This is what's going to save lives. It allows us to interact with people with BDD. We need a face to this disorder. This disorder makes you feel shamed. It makes you feel alone. It makes you feel rejected. It makes you feel like no one gets you. So having a place to be able to stand here today and to speak is invaluable. And to feel like you're not alone is just, I can't speak. And we need to put a face to this disorder. I will say, I never thought I would ever be a face to it. I'm not the face to it, but I never thought I would sit here and talk about it. It was definitely not my trajectory. It just kind of happened. If you would have asked me 15 years ago, I would never have talked about it. It was something I was extremely shameful of, extremely embarrassed of. I didn't really know how to describe it. It caused a lot of loss in my life. And it just kind of happened that I went in this direction. It happened that I became a therapist that specialized in it and decided to speak my story so that I can help others. Because guess what? Even 20 years ago, there was not enough of a face to it that made me feel understood and made me feel not alone. And if I can give that to one person, then it's worth everything I do and everything that I'm here to speak of. So we'll go to the next slide. So the take-home message. The take-home message is not that you shouldn't use social media. It definitely should be something that you should kind of watch what you're using in terms of where you are in your recovery with BDD and where you are in the distress of it. What are you doing on it? You know, it's like always like, like when you're thinking of a compulsion or intrusive thought, like, what is your goal? Like, are you going on there today to kind of look at what people are doing? Or are you going on there for like a reason? Like, you know, again, the restaurant, the vacation, to check in with a family member, a friend, but be vigilant about it and really check in with yourself on how it's making you feel. Like I used to tell people, we as people with BDD feel awful enough, right? We're in so much pain when we're suffering. We don't need external things like that to make us feel bad. When we are struggling, people with BDD, for whatever reason, are notorious for when they struggle to be judgmental of their struggle, for them to be self-deprecating during their struggle, and for them to add additional struggle. That's not what we should be doing when we're struggling. We need to be kind. We need to practice self-compassion and care. And so you really always have to check back in with yourself and say, is this helping me? Do I feel good? Do I feel worse, or do I feel the same? And if it really makes you feel bad, you shouldn't be doing it. No matter, even if other people can. We can live I said this with a client last night, and she agreed, and she happens to not have BDD. We can all live a very fulfilling life without social media. It is not necessary to live life with social media. I grew up in an age without it. I'm not saying that that's the goal, but what I'm saying is that life can be beautiful, fulfilling, and can exceed our expectations without using the screen. Being aware that it can trigger obsessions, which can lead to compulsions. And again, you know, talking with your therapist and provider that maybe during initial treatment, you want to abstain from it, reduce time from it, and use it in a positive way. Use it to advocate, use it to educate, and use it to put a face to this disorder. This disorder needs more, we need to speak more. The BDD Foundation of the UK does beautiful work. It's just incredible, like the things that they're doing. And it's just, I want more of that in the United States. And it's like, you know, to see, especially having this disorder for over 20 years and to see that the research is still so limited, it's the most heartbreaking thing. And so we need to use this platform in a way that we can expand upon that, and we can get the right services. We can improve upon the therapies, the medications, everything that's out there. So we can, for people with BDD, have the chance and the goal to live their best life and to not struggle and suffer. So that is my take home message for today. And I would love to answer some questions. And I'm going to go into the box. And somebody asked, how do you deal with a teen when their whole world is online to set these screen time limits? Well, if they're open to having the conversation, it's really important. It's about, depending upon where they're at. If they're open to having the conversation, then my recommendation would be like, look, you have body dysmorphic disorder. It's probably not that helpful for you to be doing it. Also, really reaffirming like, what they're looking at isn't real. Like that is huge for me. Like I almost find it in a way like comical when I go on, because I'm just like, I've seen you in person and it's fine. And you don't look like your photo and I don't understand it. But again, I'm in recovery. So I feel like somebody who's really struggling might not be able to do that. But so I would be about psychoeducation of being like, listen, you have BDD. It's probably not in your best interest to be on it for a very long period of time. You're probably going to be seeing things that are going to make you feel worse about yourself. We're trying to make you feel better. I would suggest doing things outside, like getting out of the house and moving about. That's always the answer when you're doing treatment, is to live. And I really can't stress enough that, especially with BDD, living is not just behind a screen. It makes you feel like you're living, which was when somebody can't leave the house, it feels good to have some kind of life, but it's not enough. And there's too much risk with that. Why doesn't changing the flow have a good effect on the perception in people with BDD? Because this is a disorder about your brain, and our brains don't ever see what the change is. And it's really interesting that you bring that up, because this is a disorder that there's multiple components to it. So there's environmental components, there could be family components, bullying, abuse, but also there's genetic components and biological components. And that can all lead to the development of this disorder. So this is an issue about your brain. So the person with BDD isn't seeing their flaw accurately to begin with. So then when they get any work done, they still don't see what it is they're changing. And 9 times out of 10, if they get any work done, they're extremely dissatisfied and they think it looks worse. And they have so much regret that they actually got it done. And so a person with the true diagnosis of BDD, the answer is never in cosmetic procedures. Okay. So somebody, I'm looking. So I'm going to answer somebody else's question about mirrors. Mirrors are never going to be your friends. So let's be very clear on that. It's really hard because, one of the behavioral strategies is mirror retraining. And I was just talking about this to a colleague of mine who has BDD, treats BDD. And both of us were like, I didn't really get it done so much in my treatment. I don't really promote it with my clients. Why? Because the mirror just is never going to be your friend. And truthfully, a person with BDD is never going to be able to see themselves in the mirror more objectively. So the answer to your question is, you have 2 mirrors at the same. I would just suggest to really start to begin to acknowledge that you don't love the mirror. I understand that you're comfortable with these 2 mirrors, but what I would say is you need to begin to reduce mirror checking, 1. 2, realize how you see yourself is not accurate. I know that you wrote that you feel completely triggered and it makes you sick with yourself. That is your BDD. And you have to, if you're in therapy, you need to talk to your therapist about it. If you're not, I would really, really suggest talking to your therapist. And I know how it feels. I know that when you look in the mirror, you feel that way and it makes you feel sick. Like you said, sick with yourself. And you feel like your appearance is reversed. And this is all part of BDD. And that's why the answer is not in continuing to look. It's not in having the 2 good mirrors. It's just being more than your appearance and realizing you can't really look at yourself. And that is one of the things that got me into recovery. And one of the things I talk a lot with clients is this notion that you're never going to truly know what you look like. What are some things that others can do to support those with BDD? How can your partner support me? So I always say this, people with BDD suffer tremendously emotionally, physically, spiritually, mentally. And obviously one of the things is you never want to give reassurance and it's not helpful and it's not healthy. But one thing that I do think is really important is that when you're struggling, your loved one can just say to you, I am so sorry you're struggling right now. I am so sorry that you're in this place right now. I am here for you. I am here to help support you and navigate with you. And I am so sorry that you're in pain. Because truth of the matter is, the person with BDD at the initial beginning thinks it's their appearance, but as they go deeper and deeper, they realize it's the underlying other issues that are really the issues, right? So my concern was my skin, but underneath it, I felt effective. I felt unworthy. I felt unlovable and I didn't believe that I deserved to be here. I thought, if I changed my skin, that all of a sudden those core beliefs were going to magically disappear. They didn't. And I had to work on that. And so I think if your spouse or partner just supports you in just the notion of you're not feeling okay, I'm here for you, that is the best thing that they can do for you. Nothing related to reassurance, nothing about concern with appearance. It's just unhelpful and it's not going to help you recover. Would just be an ideal to limit yourself to logging into Facebook? I think it is. But again, I'm going to say this, regardless if it's 1 time, 3 times, 10 times, I would always say, what is your drive? Why are you going on it? Is it to see what other people are doing? I really have a bad relationship with Facebook. It's interesting. I don't like it. In fact, I'm on it right now to promote what we're doing right now, but I will deactivate it actually tomorrow. So I just don't feel like it wastes my time. And not that I'm comparing, but I just want to live. Like I have a son and I have a practice and I have family and I just want to be in my life. So I'm going to say this. I'm going to say, I don't know if you have to give it a number. I'm going to say that if your drive behind it has anything to do with your BDD, it should just not be happening. You shouldn't really be going on it. I think if it has nothing, I mean, I think it's always about asking what it is. I mean, I'll be honest, I have clients that speak to me all the time and, you know, they'll be saying to me, giving me reasons why they can go for this procedure, this laser, or this skin care treatment. And I'm like, you're talking to a therapist that has this disorder. You can't fool me here. Like, we can all give reasons. You got to really sit and ask yourself, what is the drive behind it? Is this really going to be helpful for me? Is this going to be something that's going to make me feel better or worse? And really, like, again, the most important thing is, what are you following? I mean, right now, like, I'm following the BDD Foundation in the UK. I have the International OCD Foundation. I have therapists that treat BDD and OCD since I do OCD work. Like, that's kind of what I'm on. I'm not looking at skincare pages. I'm not looking at people that are promoting health and wellness. Like, I really stay away from that. So that, I think, is also important. So obviously, you know, I wanted the person to, like, maybe the person asked about BDD complicated by autism spectrum disorder. So my question is, can you elaborate on that and maybe give me a sense of, like, be more specific about, like, how you feel it could be complicated and what part of the disorder would make it more challenging. So somebody asked if you can elaborate. I don't want to, if that person can elaborate on that. So even when I avoid social media and try to live life in the outside world, I'm still seeing people in real life. Okay, so this is what you need to do. You need to immediately say comparison mind. That is the first thing, because that's what you're doing. That is BDD. You are comparing. So you acknowledge it, right? So from a behavioral perspective, and then you have to start to say, this is my BDD. My BDD wants me to compare to other people. My BDD wants me to scan other people. And you need to, initially, it's going to be a lot of you prompting yourself behaviorally to stop doing it. And eventually you're going to start to notice you're going to go out more and more each day. And you're going to be less aware of the physical concerns that you're concerned with in other people. But initially you're going to have to prompt yourself, like, and you may even decide, like, you can kind of hip yourself to it at the very beginning and kind of say at the very beginning before you go out. So, all right, today I'm going to have a feeling that I'm going to go out there. My BDD is going to take better of me and I'm going to start comparing. All right, how do I not do that? You know, and just be aware of that. But another big thing is what I call comparison mind, right? BDD comparison mind, being aware you're doing it. It is a compulsion. It's not helpful, because guess what? You don't know what it is that you look like. And I'm not saying it in a bad way, but you have BDD. So you don't know what it is you look like. And you're comparing yourself based upon you not seeing yourself accurately. And again, we know the answer in recovery from BDD is not the change in appearance. Let's see. Yes, I think you always adapt your work when you're working with anybody, including somebody on the autism spectrum. I think depending upon where they're at, I think I always say to myself this, like, you know, we're only in an hour webinar today. Like, I adapt my work to each and every individual. I do not do a cookie cutter BDD approach. Okay. I see each person and I'm very passionate about that. Why? Because I was treated by a cookie cutter approach. And guess what? Didn't really get into recovery. So I look at each until I really dove deeper myself. And when I became a therapist and really went back and understood this disorder. So I want to be clear. I think, yes, we would look at to see what, like, limitations somebody might have or what additional supports they may need. But I think in general, any good clinician should treat the person as an individual and should not have, like, across the board, like, yes, we do CBT, ERP. That's the cornerstone treatment, but there's much more that goes beyond that, more intensive psychotherapy. And so you need to treat the person as an individual. The photo you showed of women photoshopping is not, what do you mean? I'm confused by that question. What is that? What do you mean by that question? The photo you showed of women photoshopping is not BDD. Like, you asked me, is that not BDD? Is that the question that you're asking? Well, so to answer that question is that most people with BDD are not going to Photoshop themselves to look unrecognizable, because their biggest fear is that if they go into the world, someone's going to say, but you look nothing like their photo. So I know somebody that, a relative of mine that my mom saw on social media and saw a photo. And then when she saw them in real life, she didn't recognize them. And I was like, wow. I was like, that's like my biggest, that's like probably somebody's biggest fear with BDD. Like, you're not going to be recognizable. So most people, if I think the question is what you're asking, I would say most people with BDD would not filter. They would not filter. What is it? It's just people being obsessed with their image, and people without BDD for some reason are okay with filtering their image, even though they know they don't look like that. I always tell my clients, I can't speak to that because I have BDD, right? So my brain always goes to, why would you do that? I don't understand why somebody would want to change themselves to not be recognized. That doesn't make sense to me because I have BDD, and that in the depths of my pain was my fear, right? So I don't know if it's anything other than, I wouldn't probably say it's a disorder. I would say that it's people very obsessed with appearance, people thinking it's okay to they want to get a ton of likes on their photo, and they don't care that they look nothing like themselves in real life. A person with BDD does not feel that way. In fact, it's so ironic. A person with BDD is afraid they don't look like they do on a photo, and they're probably looking more like they do than anybody else in this world. Because again, this is all about a perceptual distortion and not about what somebody actually looks like. So I know we're running out of time, and I didn't know if there was any more questions that anybody wanted to ask, but I want to thank you all so much. This is something that I'm so passionate about because I think social media has some like beautiful things, and being connected to family and friends and for, work purposes. But I also think there's some really triggering things going on for people across the board with any disorder, but especially with BDD. And I just really hope that this gave you some sense of how to navigate it in a more healthy way and how to handle it when you're triggered and stressed. And again, I mean, if you have the disorder and you can receive treatment, please get treatment. You're not alone. You can always, always, always find somebody to help support you. It's the same. How do you deal with comparing? It's knowing that that's a compulsion with people with BDD. So it's really about like, there's nothing that's going to be helpful here. There's nothing that's going to help you. I understand it's about knowing it. So like, you want to stay connected with your friends, and I respect that, but it's about understanding, like, I know that I'm going to be triggered. Like, I'm not going to compare my image to this other person. It's just not going to help me. And it's going to take some time. It's going to take some time for when you get into recovery and you realize, oh, wow, this is a disorder about a misperception. This isn't about appearance. I am more than my appearance. My worth and my value in this world is more than that. And when you get to that place, it's going to be less and less triggering to see these profiles. I promise you, as somebody with BDD who is in recovery, that day does come. It comes with work, but that day does come. And so I want to thank you again. In terms of the support, I think they're going to give you some answers to that. I know that, support always sometimes is not always available in your areas. And so hopefully some people have the ability to see people. Like, I know I'm licensed in 5 states, so it allows me the ability to see people virtually in other states where there is not an in-person therapist. But thank you again so much for being here today, for allowing me to speak. The BDD Foundation of the UK is amazing. I love their work. I'm so grateful for them to allow me to come on today. And I know I'll be back with some of my colleagues next month. We're going to be talking about relationships in BDD. So I think the webinar series is going to be great for people, and it's going to be a great opportunity to learn and get strategies and feel supported. So thank you again so much.